My name is Abby Dunford, and I did my case study on carotid artery atherosclerosis. So, the introduction and patient history is it was an 82-year-old male with a history of coronary artery disease. And when he went in for his appointment, he got an EKG done and it showed high lateral repolarization disturbance, which could possibly be ischemia. So, the provider ordered a carotid artery ultrasound. In those image findings, areas of soft and calcified plaque are present along the common carotid arteries bilaterally. The plaque is greatest at the carotid bulbs bilaterally and proximal internal carotid arteries. Spectral broadening is present within bilateral internal carotid arteries. The impression the radiologist made was greater than 50% luminal narrowing of the right internal carotid artery by velocity criteria, as well as atherosclerotic plaque seen bilaterally. Pertinent information found in literature on atherosclerosis includes the following. Atherosclerosis causes plaque buildup and stenosis in the carotid artery. Over half the population over 65 years of age have some form of carotid atherosclerosis. Atherosclerosis is a systematic disease and is common with carotid artery disease and peripheral artery disease. Based on the calcification length and irregularity, it can be associated with secondary effects of coronary artery disease. Basically meaning the more calcification and irregularity, the more chances of secondary effects. The course of disease is adults with minimal lesions after 3 years will end up having 50% stenosis. When stenosis grows to over 80%, neurologic symptoms are more likely to occur. So some treatment options include therapy with medication and surgical treatment. So antiplatelet medication regimen can be used to help prevent the chance of clots to grow or cause problems. Surgical treatment can be done to remove plaque or place stents to improve the blood flow in certain arteries. Medication therapy poses less risk than surgery and should be tried first before surgery is done. With hard carotid plaque, cardiac death or myocardial infarction can occur. So for this patient, like we said earlier, he has coronary artery disease as well as high cholesterol. Due to the high cholesterol and high levels of lipids in the bloodstream, plaque began to build in his vessel walls. The treatment for this patient that was recommended was surgery to remove plaque that will allow for better blood flow in the arteries. The protocol done to take these carotid images were the common carotid artery at the proximal, mid, and distal ends, the bifurcation, the internal carotid artery, as well as the external carotid artery, prox, mid, and distal, as well as the vertebral artery and the subclavian artery. Here are some of these patients' images. As you can see, I have the left and right bulb that in 2D that shows the plaque inside the bulb, and then with Doppler that shows that there's turbulent flow where the plaque buildup is. And then over here, we have a picture of the left common carotid artery that shows a nice chunk of plaque inside the vessel, right next to the jugular. So his clinical pathway was he was prescribed to take aspirin daily. This will help thin blood to reduce the chance of clot formation. This patient also takes atorvastatin calcium tablet. This treats high cholesterol and triglyceride levels to reduce the risk of angina, stroke, heart attack, and other heart and blood vessel problems. The provider also did recommend vascular surgery to clear up the plaque. And then here are my references. Thanks for taking the time to listen.